Hello, my name is Salamatu Kumar, and today I will be discussing human immunodeficiency virus, otherwise known as HIV. The objectives for this presentation include identifying risk factors and prevention for HIV, discussing the diagnosis of HIV, discussing screening for HIV, and reviewing treatment options for HIV. What is HIV? HIV is a virus that attacks the body's immune system. If not treated, it can progress to acquired immunodeficiency syndrome, otherwise known as AIDS, which can be fatal. Some more about HIV. Here are some statistics. Approximately 1.1 million persons in the United States are currently living with HIV, and more than 700,000 persons have died of AIDS since the first case was reported in 1981. The chimpanzee version of the virus, called simian immunodeficiency virus, or SIV, was passed to humans when humans hunted chimpanzees for meat and came in contact with their infected blood. Studies show that HIV may have jumped from chimpanzees to humans as far back as the late 1800s. Over decades, HIV has slowly spread across Africa and later into other parts of the world. We know that the virus has existed in the United States since at least the mid to late 1970s. There is currently no effective cure for HIV. Once you're infected, you have it for life. But with proper medical care, HIV can be controlled. People with this virus can live long, healthy lives with proper and effective HIV treatment. Some risk factors for HIV include having a sexually transmitted infection, engaging in unprotected anal, vaginal, or oral sex, especially with multiple partners or anonymous partners, having sex in exchange for drugs or for money, and or sharing needles or syringes with an infected person. A history of sexually transmitted infections and their treatment is a risk factor because this is common for patients with HIV given shared routes of transmission and may be associated with greater morbidities. The United States Preventative Services Task Force recommends that clinicians screen for HIV infection in adolescents and adults aged 15 to 65 years. Younger adolescents and older adults who are at increased risk of infection should also be screened. Upon your initial visit with your provider, an evaluation should be obtained. The provider should gather the following information, such as risk factors previously mentioned for HIV, because again, a history of sexually transmitted infections, including a history of genital warts, anal warts, or any abnormal cervical test, should be taken. These sexually transmitted infections are common in patients with HIV given the shared routes of transmission and may be associated with a greater morbidity. The provider should also obtain a past medical, social, and immunization history. When taking a past medical history, providers should focus on the presence of common comorbidities, especially those that might affect the choice of antiretroviral therapy or the patient's response to it. Patients should also be asked about the use of their complementary, alternative, and over-the-counter therapies in addition to prescribed medications. This is important when it comes to interactions with antiretroviral drugs. How can you be diagnosed with HIV? HIV can be diagnosed through blood or saliva testing. Available tests include the antigen antibody test, and nucleic acid test. The antigen antibody test usually involves drawing blood from a vein. Antigens are substances on the HIV virus itself and are usually detectable. Antibodies are produced by our immune system when it is exposed to HIV. It can take weeks to months for antibodies to become detectable. The combination antigen antibody test can take 2 to 6 weeks after exposure to become positive. The antibody tests look for antibodies to HIV in your blood or saliva. Most rapid HIV tests, including self-tests done at home, are antibody tests. Antibody tests can take 3 to 12 weeks after you're exposed to become positive. Lastly, the nucleic acid tests look for the actual virus in your blood, otherwise known as your viral load. This test also involves a blood draw from your vein. If your provider believes you may have been exposed to HIV, or if you believe you may have been exposed to HIV within the past few weeks, your provider may recommend this test, the nucleic acid test. This will be the first test to become positive after exposure to the virus. If you believe you've been diagnosed with HIV, or if you've been diagnosed with HIV, it is important to find a specialist trained in diagnosis and treating to help you determine whether you need additional testing or not, determine which HIV antiretroviral therapy will be best for you, and monitor your progress and try to prevent disease progression. There are 3 stages of HIV. The first stage is the acute HIV infection. People in this stage have large amounts of HIV in their blood and they are very contagious. Some may have flu-like symptoms. This is the body's natural response to infection. However, some people may not feel sick initially. The next step is chronic HIV infection. This stage is also called asymptomatic HIV infection or latency. HIV is still active but is reproducing at a very low level. People may not have any symptoms or get sick during this phase, but without taking HIV medicine, this period may last a decade or longer, but some may progress faster. You can still transmit the disease in this phase. Lastly is acquired immunodeficiency syndrome, or AIDS. This is the most severe phase of the HIV infection. People with AIDS have such badly damaged immune systems that they begin getting an increased number of severe illnesses called opportunistic infections. Without treatment, people with AIDS typically survive about 3 years. Some testing that can be done that can help stage the disease and help your provider provide the best treatment are testing your CD4 T cell count. CD4 T cells are white blood cells that are specifically targeted and destroyed by HIV. Even if you have no symptoms, HIV can progress to AIDS when your CD4 T cell counts dip below 200. The viral load, or HIV RNA test, measures the amount of virus in your blood. After starting treatment, the goal is to have an undetectable viral load. This reduces your chance of opportunistic infections and other HIV-related complications. The last test is the drug resistance test. Some strains of HIV are resistant to medications. This test can help your doctor or provider determine if your specific form of the virus has resistance and can guide treatment decisions. Currently, there is no cure for HIV. Once your body contracts the disease, there is no way to get rid of it. There are, however, medications that can control and help to prevent the progression of the disease. Antiretroviral therapy is usually a combination of 3 or more medications from several different drug classes. Each class of drug blocks the virus in a different way. Treatment involves combination of drugs from different classes to account for individual drug resistance, avoid creating new drug-resistant strains of HIV, and maximize suppression of the virus in the blood. The goals of antiretroviral therapy are to prolong life and improve its quality, restore and preserve immunologic function, and suppress the HIV viral load and prevent HIV transmission. Although the cure of HIV infection is not achievable with art, it has resulted in significant reductions in HIV-related morbidity and mortality. Antiretroviral therapy is recommended for all individuals with HIV and should be initiated very soon after HIV diagnosis. There are many antiretroviral therapy options that combine 3 HIV medications into 1 pill that can be taken once daily. This slide shows the different options of antiretroviral therapy and examples. Side effects of these medications may include nausea, vomiting, or diarrhea, heart disease, kidney and/or liver damage, weakened bones or bone loss, abnormal cholesterol levels, high blood sugar, and cognitive and or emotional problems as well as sleep issues. Life with HIV does not have to be devastating. It is possible to maintain a healthy lifestyle. Ways to do this include eating a healthy diet. This provides the energy and nutrition your body needs to fight HIV and other infections, and also helps to maintain a healthy weight. You should exercise regularly, which helps the immune system work better to fight infections and reduces the risk of depression. And you should quit smoking if you are a smoker. People with HIV are more likely to develop lung cancer, head and neck cancers, cervical cancers, and anal cancers. Also, this will cause you to have a poor response to HIV treatment. Thank you for your time. These are my references.